Welcome everyone to Community Engaged Research Best Practices during the time of COVID, a phrase I really want to stop saying soon. I'm Susan Gould. I'm one of the faculty in the MICHR Community and Collaboration Core and also a professor of internal medicine and health management and policy. But I'd like to introduce our next presentation, which is about some best practices for research partnerships in the time of a pandemic, and specifically talking about experiences from the Life Cycle of Health Data Research Project. And our presenters here are Zachary Rowe, Star Garner, and Jody Platt. So take it away.
Great, thank you. So I'm going to get us kicked off, and then we'll all have an opportunity to speak about this. We put best in quotation marks here because at least I felt strongly that it feels, since the pandemic started 6 months ago, there's just sort of a constant keeping up with my own experience. And to say that we know what those best practices are seems a little early. But we'll, I think, hopefully come up with some lessons learned through the telling of an experience, the experience that we had with Friends of Parkside, Zachary Rowe, and our research team at the University of Michigan that had this grant to do public deliberations. Next slide. So the deliberation, for people who are maybe not familiar with this, is, it's a lot like a focus group, but it tends to last a lot longer than a single focus group. So we had a plan to do a 6-hour, basically day-long deliberation at Friends of Parkside in Detroit, where we would invite about 30 people to come and talk to us. It was very interactive. You have small group discussions, large group discussions, worksheets, booklets, surveys, all kinds of things. And it's, an in-person kind of event, or at least that's the way it's always been up until now. So on March 19th, we were planning to hold this event. We had recruited all of the people that we could recruit, and we had a wait list of other people that were interested. We compensate people for the day that they spend there. That was all set up. And we were ready to go. We were sort of about to do our dress rehearsal. And then next slide. And then COVID happened, essentially. But to sort of, again, put ourselves in a little bit of, memory of how that happened. The shelter in place order hadn't necessarily happened yet, but certainly the University of Michigan was starting to close down. Other states were ordering shelter in place. Hospitals were gearing up for big surges in emergency rooms and ICUs. Stores were being shut down. People were losing jobs very quickly. And Detroit, if you look at the map, in March was one of the very first places to get hit really hard by COVID. So that happened. And now we're going to sort of begin to talk about how we adapted. So Zachary.
Thanks, Jordan. So when COVID-19 hit, we had two important questions. How were we going to be able to address the immediate needs of our residents? And then the second question came later, but how can we use this as an opportunity to build the capacity of our community and our organization? Someone once said, never let a crisis go to waste. You notice neither one of those questions ask, how were we going to continue the research project? That was the last thing that was on our mind. So just in terms of how we adapted to COVID-19 in terms of the community, we conducted a needs assessment using text messaging, phone, and Google Forms. We did not call it a needs assessment or a survey because of the negative connotation those words have in the community. Because folks gotten used to hearing the words survey and needs assessment, and that means that folks are asking you questions, but they're not going to do anything or give you anything. And so we called it an application for resources, which implied that you were actually applying for resources. So that helped us a lot. Also at the beginning, we wanted to use this opportunity to collect data on residents' experiences with COVID-19 and to begin to formulate our own research questions that were important to the community and to the organization. And so that was important because, like I said, never let a good crisis go to waste. And then also we work to build the capacity of residents to participate in various virtual meetings, virtual workshops. For example, we work with our residents to participate in a Safe Sleep program that was done with the health department. And then we did a bunch of other things, but these are just a couple of things I wanted to sort of share with the group. So these things, as well as having a great staff and volunteers and a great board member. I think we have one of our board members that's on the call. So shout out to Joy. Those things put us in a position to re-engage with our research partner to focus on the research project. Next slide. One of the things I really wanted to sort of make sure that I touch upon is that Jordan sort of talked about the research project was all set to go in March. We had 30 plus people ready to participate in an all-day focus group session, right? And then COVID-19 hit, and then that was it, But even though that was going on, Jordan and her staff, they reached out to us. We worked on other research projects. None of them had to do with Jordan's original project that she was working on. And I really appreciated that, because I just felt like it just sort of made me sort of trust the research a lot more, because she wasn't emailing me every day about when can we talk about the public deliberation project. And so also, it just sort of sent a message to me and to the community that, as a researcher, she really, cared about what was going on and how it was affecting the community. And so that led us to have this improved relationship. And then back in August, and then around August, we started to sort of think about how can we sort of reimagine the original project. We knew that doing the project in person was not an option. But just spending time just sort of talking through it, one of the things I was able to share with the researchers is all the things that Friends of Parks I had worked on to adapt to COVID-19 that may lend itself to doing a virtual deliberation project. Because we had worked with residents using Zoom. We had worked with residents using text messaging and Google Form. And so those things sort of laid the foundation to begin to sort of say, hey, maybe, just maybe, we can take an in-person project and make it totally virtual. So at this point, I'm going to sort of hand it off to Star. So she's all yours.
Okay. Yeah, so I know that you all may be wondering where we went from here, and or where we are now, I guess. And so basically what we did was we went back to the original participants who had signed up, right? We had 30 folks signed up. We had people on the wait list. And so, we had the team call and send texts and, send emails, just reach out to those folks and see if they were still interested, right? Because they had already been committed to the project. They already had an idea of what the project was, right? We didn't have to re-explain it to them or anything like that. And, they had been expecting to complete this project. So we reached out to them. We did get about 15 of those participants to sign up for the virtual conference. And so we still had to do some other recruitments, right? We sent it out to other folks in Parkside and others. And once we did reach our goal of 30 again, we thought, well, now that it's virtual, is it more comfortable for folks to still do the 6-hour day, or should we give them a different option? So we reached back out to participants and we asked them, would you prefer to do would you prefer to break the day down into 2 days and have 4-hour sessions? And most people did prefer to do that. So and then we asked also, which video conferencing tool would you prefer? We gave them options, and most people were interested in using Zoom. Okay, so we switched over to Zoom, and we weren't still able to assume that just because most people prefer to use Zoom, that they were able to download Zoom, or that they, were able to log into sessions or call in or use the mute button or anything like that. So in order to verify that we'd have a smooth process, and when things got started up, everyone would be able to log in properly, we set up 2 open house trainings to make sure that, we only get this one chance to execute this, right? And so we wanted to make sure that we did everything we could, so that they're not trying to like learn Zoom while we're logging into the sessions. And, although we put all this thought and effort into these things, I think there's still like an area of gray, right? There's still this chance of, or the space of uncertainty. We don't really know exactly how well these practices will go. Like Jordan said, we're calling it best practices, but in quotation marks, we're still learning throughout this process. And I think it'll be interesting to see, the results of all of the thought we put into this, and the way we went about it, and what areas worked well, and what areas we could have improved in. Next slide. I think this is you, Zachary.
Nope, I think it's actually Jordan, so she's all yours.
All right, so we're sort of all going to do the last slide, I hope. But the idea is now we can just sort of, reflect on what we've thought about, and sort of what are the lessons that we are learning in terms of what the how to work in the context of a pandemic. I think, we found that the principles of CVPR have been very helpful. They still apply. I know that we've both appreciated flexibility on both ends, and when you need to stop, you stop and reassess and move in a different direction. And eventually you can begin to sort of make a plan. In this case, the plan is to move from an impersonal context to virtual. I think that the work that Friends of Parkside did to find out what people need, has multiple sort of value points to that. So clearly there was an immediate need for that, but it's also been helpful for understanding how research is going to work in the future. And again, sort of beginning to build on the strength of the community, build capacity when you need it, and sort of stay in this learning mode. I think the other thing that we've learned is that people are okay. There are people interested in the virtual format, which was also, we didn't know. It wasn't imagined for this type of research. It wasn't so much of the value of it was seen in being in person. And so we're going to try it virtually, and we'll let you know how it goes. Zachary, Star, there are other, should we?
No, I think you hit some really good points, and so good.
Yeah.
Well, I love your last point of stay in learning mode, and I think that fits with your, best practices in scare quotes, since we don't have best practices for anything in COVID yet, really. So, and certainly the virtual community engagement, I think, is something we all need to learn more about.